Hello. So, Pamela is a 75-year-old female who was just admitted to the acute care hospital following a fall at home. She did not sustain any injuries, but is becoming progressively weaker due to her chemotherapy treatment. So, during occupational therapy, the OT would be working with bed mobility, increasing her upper extremity strength, because she resulted in less strength against resistance and improve her endurance and decrease her RPE levels. It would be important to address some techniques to complete basic ADLs independently, such as improving energy conservation and giving her some techniques such as sitting while completing these tasks, having everything within reach, and so that she doesn't have to walk around and try to get all these items gathered while she's trying to save her energy for other things. Adapting some grooming tools, such as putting a strap on her toothbrush or her hairbrush, and then building up her handle, making it thicker so she doesn't use as much fine motor grasp strength. And then while she's using the toilet, she could use a transfer bench with a commode opening. Um, so it would be easier for her to transfer from her bed to the commode. And also during this time, educating her about keeping her clothes above her knee so she doesn't have to reach all the way down to her ankles to bring it up when she's done. And then maybe trialing the toilet paper clip to help improve her pericare independently, kind of practicing with that, seeing if it works for her. And then lastly, educating on some pain management, such as using water aerobics to increase her strength, as well as helping with that pain, some chair yoga, deep breathing, and stretching. For PT, this would look as increasing her lower extremity strength and endurance with resistance. It was noted that her hip flexion, extension, abduction, and adduction are a little lower than the other movements, so working on this during treatment would be important. And then increasing the distance while ambulating. And since she's using a single point cane, working with the front wheel walker to improve her stability while walking, and possibly having a seat if she does become fatigued, so she can just turn around and sit down, and then it wouldn't be a problem. And then lastly, speech language pathology. This would be increasing her strength and endurance within her mastication and swallowing muscles, since she is having problems during swallowing and feeding and is losing a considerably large amount of weight. And then educating the patient on sitting posture and head position while feeding. It does note that she is having good posture during this activity, but still reemphasizing the importance of this to improve her swallowing technique and safety. And then provide some strategies to improve the swallowing, and then eating softer foods and thicker liquids. So some treatment plans during this time. The OT can work with PT and the speech together for multiple reasons. So one treatment plan could be with the PT. So starting out, getting her from supine to edge of bed, and progressively decreasing the amount of assistance during this task. And then while she's at edge of bed, completing some arm exercises. And while this is being done, they can switch off with the PT, and the PT can complete some leg exercises. And then when this is complete, the patient can do some grooming and hygiene, and some she can change her clothes and do all this during edge of bed. And then during this time, they can use the built-up handles for the brush and see if this helps with function and independence. And then they can complete a sit-to-stand transfer and walk with the front wheel walker to the bathroom. And during this time, the PT would be looking at the gait patterns measuring distance and RPE levels, and the OT would also note this in documentation. And then seeing how the transfer goes to the toilet. Completing the pericare with the toilet paper clip would be important to see if there's any difficulty with this or if it helps with her participation. And then after this is completed, then a sit to stand transfer again, and then walking to her chair and seeing the PT would be looking at the same things during this time as well. And then transfer the chair, see how she does independently or how much assistance she needs, and noting how she does on her own. And then for an OT and speech code treatment, for speech, it would be important for them to do a swallow study, doing the fluoroscopy, and just kind of seeing what the problem area is and focusing treatment around that. And so when the OT and speech work together, they would be doing a feeding activity, and the OT can make a built-up handle for utensils as well, and kind of seeing how that works, and if an angled utensil would be more beneficial for Pamela. And then both the OT and SLP would be looking at posture during this time and just continuously educating about the importance of this. And then during this time, the patient might be hooked up to e-stim to facilitate the swallow and improve her strength and function during this time. And then the speech language pathologist can educate the patient on how to squeeze the muscles to swallow and hold breath while this is happening. And this can be before even giving her any food, just to have her practice before possibly bringing in some safety risks and everything. And so something I read was to pretend that the patient is swallowing a pill without water and kind of just practicing with that and holding the breath while this is going, while she is doing this. And then they can introduce the food after that, after the practicing of the swallowing technique, and they can use the softer foods and thicker liquids to increase safety and improve ability to swallow. And this would help her understand and make it, and they can gradually decrease the thickness and reintroduce other foods if this becomes more safe for her to complete. And then during this whole time, just educating about different techniques that will help improve function and independence. And if the husband is ever in treatment, kind of bringing him into the intervention and practicing with him, and just giving him information, education about everything, and maybe giving him some brochures about different tools, such as like the toilet paper clip, angled utensils if that's important to them, the transfer bench with commode if it's still showing that she's having difficulty using the toilet, and then the other pain management techniques, and then giving this information to both of them will increase efficiency for the transition from therapy to the home life, and make for a better and more efficient transition. Thank you.